Comparing traditional Medicare versus Medicare Advantage. For those who are eligible for Medicare coverage, the options can be confusing. In the next several minutes, we'll compare traditional, also known as original Medicare, with Medicare Advantage to help you decide which one best suits your needs. So, just what is Medicare? Medicare is a federal health insurance program, primarily for people aged 65 and older. It also covers some younger individuals with disabilities or end-stage renal disease. What is Traditional Medicare? Traditional Medicare was established in 1965 and consists of four main components. Part A covers inpatient hospital stays, skilled nursing facility care, hospice care, and some home health care services. Part B covers outpatient care, including doctor visits, preventive services, durable medical equipment, and certain other medical services. Neither Part A nor Part B cover outpatient prescription medications, so Medicare beneficiaries have the option to enroll in Part D for prescription drug coverage. Medicare C is also known as Medicare Advantage and is actually an alternative to traditional Medicare. Medicare Part A is free for most people who have worked for at least 10 years. You must pay a deductible cost for each hospital admission, which is $1,736 in 2026. There are daily co-insurance costs for stays longer than 60 days. Medicare Part B has a minimum base premium, $202.90 in 2026, which is adjusted upward for those whose income is higher. If you do not sign up when you are first eligible, you will pay a penalty of 10% for each year that you fail to sign up. This penalty is added to your monthly premium and is permanent. This penalty does not apply if you are Medicare eligible, but have qualified health insurance through your employer or through your spouse's work. Part B has an annual deductible of $283 in 2026. In addition, you will pay 20% of the allowed costs, known as co-insurance, for Part B services after you've met your deductible. Part D costs depend on the policy that you choose and may also be affected by your income level. If you fail to sign up for Part D coverage when you first go on Medicare, and you do not have other creditable drug coverage for 63 or more days, you may pay a penalty of 1% of the premium cost for each month that you do not have adequate coverage. This penalty will apply to your Part D costs for as long as you have Part D coverage. Part D out-of-pocket covered drug costs are capped at $2,100 a year for 2026. With traditional Medicare coverage, the government directly pays doctors and hospitals for the medical care they provide to Medicare patients. Since there are deductible costs associated with Parts A and B, as well as the 20% co-insurance costs for Part B services, many people who have traditional Medicare opt to purchase what are called Medigap insurance policies to help cover those costs. A Medigap policy is supplemental health insurance sold by private insurance companies to fill the gaps in traditional Medicare plan coverage. Eligibility requirements for Medigap are the same as for Medicare A. If you sign up for a Medigap policy when you first become eligible for Medicare, you are guaranteed to get the policy that you want, and you cannot be charged more for having pre-existing conditions. What are Medicare Advantage plans? For Medicare Advantage plans, or Medicare Part C, The government pays private insurance companies so much per enrolled patient, and then the insurance company pays the providers for the care that patients receive. If the insurance companies pay out less for care and overhead than they receive from the government, they keep the difference as profits. Medicare Advantage plans bundle Part A, Part B, and often Part D coverage into a single plan. They may also include additional benefits such as vision, dental, and wellness programs. You may be wondering, what are the main differences between traditional Medicare and Medicare Advantage? Traditional Medicare is a government-run healthcare program, while Medicare Advantage is a coverage program run by private companies. Traditional Medicare generally involves higher out-of-pocket costs, including deductibles and coinsurance, particularly if beneficiaries do not purchase Medigap policies. Medicare Advantage plans may offer lower premiums and out-of-pocket expenses compared to traditional Medicare. However, they frequently require co-payments for services, and they can and do restrict the providers that patients may access. These limitations may be local. For example, by limiting access to only one cardiology group or hospital in town, or they may limit the geographic distribution of providers, such as including only providers within a given county or state. Another key difference is that Medicare Advantage plans often employ pre-authorization requirements for various services, meaning that the insurance company must agree in advance to cover a requested test, procedure, or specialist visit. Traditional Medicare historically has not done this except in special circumstances, although they are now piloting pre-authorization programs in 6 states: Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. Pre-authorization policies can cause delays and denials of necessary care. Medicare Advantage plans hope to improve health outcomes and lower costs through coordination of care and disease management programs. Given its structure, traditional Medicare may not have the mechanisms to provide integrated care management, leading to siloed care, where the different doctors taking care of you may not be working together on your problems. To review, let's look at some pros and cons for both traditional Medicare and Medicare Advantage. To summarize the pros and cons of traditional Medicare. Pros: nationwide coverage. Medicare is accepted by most healthcare providers across the country. Standardized benefits. Traditional Medicare offers standardized coverage, making it easier to understand. Flexibility. With traditional Medicare, you can go to any healthcare provider that accepts Medicare. Except in limited and developing circumstances, traditional Medicare does not have pre-authorization requirements. Cons: Medicare alone does not cover all healthcare costs, such as co-payments, coinsurance, deductibles, and medications. Beneficiaries often need to purchase supplemental insurance, such as Medigap policies and Part D drug plans, to compensate for these gaps in coverage. No out-of-pocket maximum. Traditional Medicare does not have an out-of-pocket maximum limit, potentially leaving beneficiaries at risk of high costs. To summarize the pros and cons of Medicare Advantage. Pros: more comprehensive coverage. Medicare Advantage covers all services that Medicare covers, in addition to extra benefits that may vary by plan, such as dental, vision, hearing, and prescription drug services. These other services, known as supplemental benefits, can include health-related benefits, such as home-based palliative care, in-home support services, caregiver support, and over-the-counter OTC benefits. Some supplemental benefits are optional, while others are covered for everyone enrolled in the Medicare Advantage plan. Cost savings. Medicare Advantage plans may offer lower out-of-pocket costs and annual out-of-pocket maximums. Care coordination. Many Medicare Advantage plans provide care coordination services to help manage healthcare needs. Cons. Network restrictions. Medicare Advantage plans typically employ provider networks, which means you may be limited to only using the doctors, hospitals, and other healthcare providers within the plan's network. Going out of network may result in higher costs or lack of coverage altogether. This can be problematic if you have established relationships with doctors or hospitals outside of the network, or if you spend time in different locations during the year. Prior authorization requirements. 99% of people enrolled in Medicare Advantage plans are subject to prior authorization for certain medical services or procedures. This process can be time-consuming and may delay or deny necessary care. Traditional Medicare does not usually require this. Plan changes. Medicare Advantage plans can change their coverage, costs, and provider networks from year to year. This means that you should review your plan options annually during the open enrollment period to ensure that your current plan still meets your needs. Potential for increased out-of-pocket costs. While Medicare Advantage plans may offer lower premiums compared to traditional Medicare, you may still face out-of-pocket costs, such as copayments, coinsurance, and deductibles. Complexity and variability. Medicare Advantage plans can be complex, with varying levels of coverage, costs, and benefits. Comparing plans and understanding their terms and conditions can be challenging, especially for those with limited health literacy or cognitive abilities. Limited coverage outside service area. Some Medicare Advantage plans may provide limited coverage, such as only emergency care, for healthcare services obtained outside of their service area, which can be problematic for people who travel frequently or reside part-time in different locations. Medicare Advantage plans may have limited availability in rural or underserved areas, resulting in fewer options for coverage compared to urban areas. When choosing between Medicare and Medicare Advantage coverage, consider factors such as your health and medication needs, budget, preferred doctors, and hospitals, and whether or not you are likely to need medical care beyond the area of your primary residence. Review any Medigap or Medicare Advantage plan's benefits, costs, network, restrictions, and quality ratings before deciding. Note: if you are beyond 3 months from the initial enrollment period when you first sign up for Medicare or Medicare Advantage, and you want to switch from Medicare Advantage to traditional Medicare, you can do so during Medicare open enrollment from October 15 through December 7. Coverage will start January 1st, or Medicare Advantage open enrollment from January 1 through March 31. Coverage will start the first of the month following your request. However, if you leave a Medicare Advantage plan and want to purchase a Medigap policy, your health conditions can affect your Medigap premium rate and whether or not you are denied Medigap coverage altogether. In conclusion, traditional Medicare and Medicare Advantage plans have distinct pros and cons. While traditional Medicare has more flexibility and broad access to providers, Medicare Advantage plans offer integrated coverage and potential cost savings through managed care arrangements. To choose between traditional Medicare and Medicare Advantage, consider your healthcare needs, preferences, and financial circumstances. This will help you make the best decision for your situation.